So in order for products to be sold in this country, they will have had to have passed safety standards. But actually, the safety standards would have been around whether they're fire resistant, etc. It doesn't show that they're safe for babies to sleep. And obviously, they're sold as sleep aids. And if you remember back to what we talked about earlier when we were discussing normal infant sleep patterns and that ability to sigh, gasp and arouse, that actually we're not wanting to achieve a deep sleep. And many of these products go against that advice that you've just heard: a firm, flat, waterproof mattress. So there's all sorts of things available. They might include various sorts of pods, bean bags, nests, swaddling wraps or cocoons. And then there's also the Next to Me crib, which is the one that was the last one to come up. So the Next to Me crib in itself is fine, but this is a crib that is designed to have one side that can comes down and pushes directly against the parent's bed. That obviously leads to the baby being in a shared sleep sleep environment with parents. The risk of parents bedding pillows and duvets and things coming into the baby's bed. Also the risk that the baby could roll away from into the parent's bed, maybe get caught or lodged in that join. So if you do have families that are using this sort of Next to Me crib, if you advise that once they've settled the baby and they're going to go to sleep themselves, that they elevate that side fully. And then there's various sleep positioners that stop the baby from rolling over. Yes, we want them to sleep on their back, but however, if they roll into these sort of cushioned areas, that can occlude the airway. And then you've got sorts of bouncy chairs that keep the baby in a more of an upright position. The risk with these is that the baby's head pushes forward. Sorry, Laura. But shush. So the risk with the car seat or the bouncy chair is that the baby's head pushes forward into the neck, because the babies have large heads, and that can occlude the airway, and that's why we recommend that babies are laid flat. And the car seat, obviously, it's safest for babies to travel, but babies shouldn't be slept in that outside of the car. If they fall asleep in the car, then that's fine. But when you get to your destination, you should be lifting the baby out of the car seat, removing any additional layers so they're not at risk of overheating, and then placing them, if they're still asleep, down on that firm, flat sleep surface. And then you've got the hammock as well, which you can see obviously is not firm or flat at all. So the Lullaby Trust do produce a product guide. You can get that. I think you can order hard copies. I think there's a cost involved, but it's downloadable and printable off their website, or you could download it. Email copies or email links to families with that. But they're definitely not recommended. Pods, nest, pillows, duvets, thick, heavy bedding, cot bumpers, hammocks, and sleep positioners. In fact, what a baby does need to sleep is a separate cot or crib or Moses basket and a firm, flat, waterproof mattress. They don't need anything else. The other things that you might want to consider or advise families to consider is a portable safe sleep space, a Moses basket, a travel cot, a carry cot, something that can go with you if you going out to visit family or friends, or going to stay overnight in a hotel or something, you do need the mattress that's in a good condition, firm and flat, and so with a waterproof mattress. The sheets and blanket or baby sleep bag, a room thermometer to keep an eye on the temperature of the room, and the car seat for purpose of car travel. Often products will claim that that they're safe and that no baby has ever died of SIDS, but whilst using that product, but that doesn't necessarily say that they are safe and that they are following the guidance. The Lullaby Trust also advise a clear cot is a safe cot. So babies are more at risk if they've got their heads covered or if they're overheated. Keeping the cot clear of other items, bumpers, toys, extra loose bedding, unnecessary extra items in the cot. Also, as the baby gets older and more mobile, they can be increase the risk of accidents as well. So baby sleep bags. So that's a sleep bag, not to be confused with a sleeping bag like you might use to go camping. So they're a bag. They've got they're sleeveless and hoodless and well fitted around the arms with the thick sort of shoulder straps, as you can see in the illustration there. They are suitable from birth if you've got a baby who weighs over 4 kilos, or otherwise they're suitable when your baby reaches the weight of 4 kilos or £8 8 ounces. You can get them in different TOG ratings, so that's the same as your duvets. It's the warmth rating, the same as with your duvets will be marketed as. So they need a really lightweight one, 0.5 to 1 TOG in the summer, and no more than 2.5 TOGs in the winter. They shouldn't be using any additional bedding with that. So the baby should be wearing vest or baby grow inside it, but no extra blankets or anything covering. It needs to be well fitted around the arm, so it needs to be the right size for the babies, just so that they're not at risk of slipping down inside it. So the other thing that families may ask about is about swaddling, or that you might witness. So swaddling is often used to try to help settle babies and to promote sleep, but there's actually no consistent advice, no consistent evidence around swaddling and the potential risks. But what we would say is that the risks are around potential overheating because they're well wrapped in it. Also, that risk of arousal from sleep because it's something that's used to try and encourage baby to sleep for longer. So actually, remember that we're not wanting them to sleep solidly and deeply for long periods. We're wanting them to be able to rouse and gasp. So if you are working with families and parents who are choosing to swaddle, it's about making sure that they're doing this in the safest way to reduce risks, using thin materials, so a sheet, not a big fleecy woolly blanket, not to swaddle above the shoulders, never put a swaddled baby to sleep on their front, the same as we would advise that they're always sleeping on their back in every instance, not swaddling too tightly. They do still need to be able to wriggle and move because they need to be able to arouse. And keeping an eye on baby's temperature so that they're not getting too hot as well. Propping as well. So this might be something that you see in practice. So propping, supporting the baby in a position that's not naturally sustained. So using something, some kind of equipment to keep the baby in a more upright position. So that might be cushions, it might be towels, it might be, you can see there, books underneath the back of the cot. So by raising the level of the sleep position, that increases the risk of positional asphyxia. So you can probably see this quite clearly on the two in the corners. So the picture of the baby on that, the sort of the U-shaped cushion in the top left corner, and the baby in the bottom right corner who's in the bouncy chair or car seat. You can see that because they're quite propped upright, their head's pushed forward. And because the baby's airways are quite floppy, as the head's pushed forward and the neck's secluded, that can occlude the airway. So that's what's known as positional asphyxia. It also obviously risks that the baby can slide down the cot and slide down underneath the covers and end up with their face covered as well. The safest sleeping positions on a firm, flat surface. Historically, there's probably been advice, and I know that I've seen this in practice, that it raised or propped sleep surface has been maybe recommended for babies who are unwell with conditions like reflux or bronchiolitis. But actually, there's not any evidence really to suggest that elevating the head of an infant's crib whilst they're lying on their back actually helps to reduce the symptoms of gastroesophageal reflux. Elevation is incredibly high. There's a real concern about the adequacy of their airway and the chest position. So actually, even the small elevations might cause a risk for the baby. And in fact, if you look in the NICE guidelines about gastroesophageal reflux disease in children and young people, it's quite clearly documented in there not to use positional management to treat gastroesophageal reflux in sleeping infants, to follow the guidelines and advice about placing them on their back to sleep. So just to reiterate, safe positioning of a baby, placing the baby on their back to sleep. If they roll onto their side or front, gently move them onto their back. So it might be in young babies that they do move over onto their sides, but that's more of an involuntary reaction, that they stretch and they accidentally turn slightly. So for those young babies, if you do notice that they've rolled over, gently move them back onto their back. However, once you've got a baby who can move themselves independently and they're rolling over from their front to the back and the back to their front, they'll find their own comfortable position, and all sorts of weird and wonderful positions they are. So that's okay. If they're able to roll themselves, they're also able to move themselves if they do get into difficulty. So they are, if the face becomes covered, they'll move themselves out of that position. So the importance of routine in reducing the risk of SIDS is making sure that they're on their back for every sleep, and that's sleeps in the daytime. It's not just the daytime or the main sleep. It's about being consistent with that, so the baby gets used to that routine and that sleep position. If your baby's positioned differently during an episode of hospital care, so for a baby that spends some time in the special care baby units, or prem babies, or babies that have had a readmission if they've become unwell with something like bronchiolitis, when they're in hospital, they're being supervised. There's nursing care there. There's access to them being monitored. There's access to the crash team and intervention if there are any issues. That's not the same as when they're at home. So babies who are being discharged home will need to get back used to sleeping in a different position. So I think bear in mind on this, they might have got used to sleeping in a different position and they need to get back to the sleeping flat on their back and sleeping on their own in their own being put down in their own sleep surface, their Moses basket or cot. But don't forget as well that there's the perception that maybe they slept well in hospital, but that's because they were unwell at that time, the same as we might sleep for longer periods when we're poorly. It's they're more well and so therefore sleeping less time as well. So it's just about advising parents that they will get back used to that position and to persevere, really. If there is any other position recommended for ongoing medical care on medical reasons, that should be on the specialist advice of the paediatrician. So that might be recommended for babies that have got certain things like craniofacial abnormalities that mean that the shape and position of their airways is different, but that should be on specialist advice. So if that is the case, or you're getting parents who are unsure, it's about checking back with the paediatrician or the doctor who's got the overall care of that baby, just to verify that is an ongoing thing. Hopefully it's been documented and it's on discharge paperwork, and everybody's clear about what's been recommended for this baby. So one thing that parents may tell you that they're concerned about, particularly if it's a baby who does suffer with gastroesophageal reflux, that they're concerned about vomiting and what will happen if they're lying on their back and they're sick. They bring up some milk. Are they at risk of that milk going into the airway? Are they at risk from that? And that's why that's a reason that they might give for putting them on their front, so that the milk comes out of their mouth more easily. If you look at these diagrams here, you'll actually see that the opposite is true. So that the airway, when they're lying on their back, the airway is above the digestive tract. If milk comes up, it's likely to go back down into the digestive tract. If you can see that the bottom diagram where the baby's lying prone on their tummy, so the digestive tract is higher and the airway is below. So if some milk comes up the digestive tract from the stomach, it's actually at risk of going down into their airway before it reaches as far as coming up to their mouth for them to be visibly sick. So actually, when they're lying on their back, they're there's less of a risk of milk entering the airway, which I think this illustration helps to understand why that is the case. So we mentioned car seats earlier. So yeah, car seats are absolutely what we need to keep babies safe while we're travelling, but they're not designed to be the baby's main sleeping space. They should be used for transport. If they fall asleep in the car, like I say, when you get where you're going, take them out, and if they're still sleeping, put them on the firm, flat surface to sleep. That's why you might want to take a carry cot or a Moses basket or travel cot with you. There's actually no evidence about how long babies should be kept in a car seat. Most professionals agree that and recommend that no longer than 2 hours at a time, and take them out frequently. There has been some suggestion that 30 minutes is enough. Actually, the risk is more with younger babies and preterm babies. And actually, the best thing to do in that instance is avoid travelling in cars for long journeys with very tiny babies. If you are going on longer journeys, stop regularly, take them out, and obviously that gives everybody a chance to be refreshed as well. The other piece of equipment are slings and baby carriers, and again, there's no particular data about how safe they are in relation to SIDS. The risk appears to be that the baby's airway can be obstructed either by their own chin resting down on their chest, so again that head forward and their airway occluding, or the other risk in this is that their mouth and nose are covered by the parent's skin or clothing because of the position of their face. So the safest type of carrier keeps the infant firmly in an upright position where the parent can see the baby's face and ensure that their airways are free, and follow the ticks rule. So if you're wearing a sling or carrier, keep them in tight, keep them in view so you can keep an eye, the parent is able to observe baby's face, that they're close enough to kiss. So that just means that they're high enough up on parent's body that their mum or dad's able to put their heads down and kiss the top of the baby's head. So it's just about the position that they're at. So they're also not on your that they're on a flatter piece of chest there. They're not at less risk of becoming covered in by parents' skin or bulky clothing in the winter time. Keeping their chin off their chest so that their airways remain open, and supporting baby's back and keeping them in. And that's about keeping them in that upright position as well. Dummies. So dummies have been associated with lower rates of SIDS, and that is mainly so that's about regular use of a dummy associated with the lower risk, including in the latest sleep period. So there were less incidents of babies who had had sudden infant death whilst using a dummy. And that's probably to do with a little bit about maintaining a degree of alertness, not dropping into such a deep sleep that they're not able to rouse. So the advice with dummies is, if parents wish to use a dummy, use them consistently for every sleep period. Withdraw use dummies between 6 and 12 months. Don't force baby to take it. Don't dip it in sugar or anything sweet to try and encourage the baby to take it. If they're not interested, they're not interested. Establish breastfeeding before introducing a dummy, and that's just because we also know that breastfeeding can be a protective factor, and breastfeeding needs to be established before introducing it because of the potential risk of confusion about the different teats. Don't use a neck cord. Obviously, we don't want to potentially reduce the risk of sudden infant death, but introduce the risk of something that can get tangled around their wrist. So that obviously makes perfect sense. And the orthodontic shaped dummy, so the one that you can see in the background there, is the best. That's more adapts more naturally to the shape of the baby's mouth. So smoking and perinatal health. So we've said that smoking during pregnancy and after birth can increase the risk of sudden infant deaths, and actually they are two of the main risks So both maternal smoking during pregnancy, but postnatal exposure to tobacco smoke as well. Sudden scientific evidence shows around 30% of sudden infant deaths could have been avoided. Excuse me. Could have been avoided if mothers didn't smoke while they were pregnant. And combined with the risks of smoking within the home, that smoking could be linked to about 60% of sudden infant deaths.